Ethics has as its focus beliefs and behavior, while psychology is known as the science of the mind. And many philosophers have looked for a connection between ethics and psychology. Some notable individuals who contributed to the combination of ethics with psychology include Freud, Kohlberg, and Gilligan. Freud was a psychiatrist who explored the origins of the human psyche with a novel approach which is known today as psychoanalysis. The most important aspect of Freud's work is his development of theories about the mind, the id, the ego, and the superego. Freud proposed the idea that the neurotic behaviors he observed in his patients could be attributed to hidden causes in their minds and could only be cured by seeking explanations for them. He believed that repressed memories contributed to neuroses, and that normal repression differed from the type of repression that caused neurotic illness only in degree, not in kind. What this means is that repressed memories are commonplace in the human psyche, but those people who suffer from neurotic illnesses repress memories with much greater intensity. Freud believed that humans were born with the id, which is based on the pleasure principle, growing and developing into the ego, which is based on the reality principle. The ego's task is to meet the needs of the id, but to also consider the reality that others have needs and wants, and that to be completely selfish is harmful. According to Freud, a belief in God and moral values were imparted to children by their parents early in life, and the lessons learned were imprinted on the superego or human conscience. Kohlberg's theory of moral development was an adaptation of Jean Piaget's work in children and how they develop morality. Piaget believed that children observed the world around them and determined what actions were necessary to develop good relations with their peers. So, Piaget differed from Freud, who thought morality was a parent-to-child interaction, not a peer-to-peer interaction. Kohlberg developed his scale of moral development with its 6 stages to show how individuals justify behaviors, not to show how moral they might actually be. In fact, Kohlberg's theory has been particularly criticized for this, and Kohlberg admitted that higher stages of moral reasoning do not necessarily translate into ethical behavior. Despite the criticism, one can see how Kohlberg's sense of moral development applies reasonably well to children. At the earliest stage, a child is focused on rewards and punishments. The child is self-interested and not a sophisticated thinker, so if the child wants a certain toy, snatching it away from another child seems right until a fight ensues. The child may then decide that bargaining or trading is a better option than fighting, which results in punishment. Eventually, through a desire for admiration and respect, a child internalizes a sense of right and wrong. The highest position on the scale is recognition of universal ethical principles of right and wrong, where development has reached the level of understanding justice. Unfortunately, having a sense of justice does not always equate with acting justly. Carol Gilligan, a psychologist who believed Kohlberg's scale favored men, suggested there are 2 ways to think about ethics. One was to think of ethics as about inviolable rights and universal principles, and another was to focus on the ethics of care, which emphasized people's interdependence. She sought not to reject past thinking about ethics, but to supplement it, and perhaps to correct for deficiencies, and by doing so developed a new theory of ethics that is widely used in nursing.